Hello and welcome to this recorded presentation for the employees of Performance Titanium Group. This is regarding employee benefits beginning December 1st, 2023. My name is Bill Hammett. I'm happy to be your insurance broker and your insurance expert. You can reach out to me through this open enrollment process if you've got questions about the plans available, if you need help understanding what's best for you and your family, need help finding doctors, whatever it may be, we're here to help you make a good decision for you and your family, an informed decision for you and your family. So please lean on us, me specifically, through that decision-making process here to start. Also available now and throughout the year is Rhiannon and Anna. They are great for finding doctors. If you lost your ID card, if you need to help with a claim or something like that, we're here to help all year long. Quick look at our agenda. We'll go through our timeline of open enrollment, the medical plans, dental. There's not a lot of changes this year, so it should be pretty easy. Our open enrollment, our open enrollment time frame is October 16th to October 25th. We might find ourselves launching this a little sooner than that, but this is when we are going to be setting up our original open enrollment period for. This is your time to enroll or disenroll, to change from one plan to the next, whatever it may be, add or remove dependents. Whatever you do, the changes will be effective December 1st, 2023. So even if you do this immediately on October 16th, the changes will still not happen until December 1st. Again, we're asking everybody to be complete with this no later than Wednesday, October 25th. We have 8 medical plans available from Blue Shield of California, just like we did last year, 5 HMO plans, 3 PPO plans. Notice we've got a couple of different names. We have our Trio HMO plan. So there's 3 Trio HMO plans and 1 Access Plus plan. Okay, I'm sorry, 4. There's 2 Gold Trio plans, 4 Trio, 1 Access Plus. This Access Plus is the largest HMO network. So if you want access to more doctors, it's going to be through this Access Plus HMO. For most of you, though, the Trio HMO has been very good. It helps you access Scripps doctors. And then we have our 3 PPO plans. This is for those of you that want to be able to have as much freedom of choice between providers as possible. If you need to see a doctor at Scripps, but a specialist at Sharp and have surgery at UCSD, you're only going to be able to have that kind of freedom of movement with a PPO plan. So that's why you might choose a PPO plan. So let's talk about our plans that we have here. We are looking right now at our silver and gold plans. So we have 1 silver plan. It's our lowest cost option. And then we have 2 different gold HMO plans. This gold HMO plan here has got a little bit higher of a deductible at $1,500 versus our Trio plan at $500 here on the far right. Our silver plan is going to be the highest deductible of $2,300. We've been through a lot of this terminology in the past, but I'll do it again real quick. A deductible is basically what the insurance company says you must pay all of this before we pay anything. Now, there's many exceptions to that. If you follow my cursor down the screen here, we see the words DED waived next to office visits, next to diagnostic lab and x-ray, next to MRIs, CAT scans, PET scan at freestanding facilities. This is physical therapy, occupational therapy, speech therapy. We have chiro. We have all the way down here at the bottom, urgent care. Wherever you see this term DED waived, it means the deductible is waived and you get to pay only that number, and that's your complete payment for that service. All right, so if I'm on the silver plan here and I need to see a regular doctor at $70, a specialist is $80. Notice our gold plans have lower copays for these things, $35 and $65, but always the deductible is waived. So that means if I need to see a doctor, I do not need to spend $2,300 first. I can just pay the $70. If I need blood work, I pay $65. If I need a CAT scan, PET scan, or MRI in a freestanding facility, so this is a non-hospital facility, they waive the deductible and all you pay is $100. Now, if you get that benefit in a hospital facility, it's $400 after the deductible. Now, when you see after deductible, that means that you must have spent this $2,300 before you get this $400 copay. All right. So if I'm in a situation where I'm in an MRI and it costs $900 and I haven't met my deductible, I will have to pay all $900, and then I will just have $1,400 remaining on my deductible. Okay. So these deductibles are a rolling number. It's not a per event number. All right. Down here, we see our prescription drug benefits. Some of them have brand name drug deductibles. So if I'm on this silver plan and I need a tier 2 or 3 drug, I will have to have paid 100% of the cost for those drugs up to $450, and then I get these copays. All right. Also of note, you see that there's level A and level B pharmacies. Level A are preferred pharmacies, level B are non-preferred pharmacies. There's a slide here in a moment that gives you a little more detail on this. Just remember that there's a little bit more homework you need to do to make sure you're going to a level A pharmacy so you don't pay quite as much. Notice when we get to the expensive stuff, a tier 3 brand name drug costs $115 at level A, but $155 at a level B. All right, so it's important to understand that difference and how to access the lower cost level A pharmacy. Then you get into the expensive stuff, hospital stays, emergency rooms, okay, 50%, 40%. Now what this means is you pay 40% of the total cost after your deductible, all right? So I first paid $2,300. Let's say I had that MRI already, so I paid $900 already. I only have $1,400 left and I go to the hospital. It's a $100,000 hospital stay. I'm in there a week. I pay 100% of my remaining deductible, which is now $1,400. After I've paid that, I pay 40% of the cost. Blue Shield pays 60% of the cost until the total I have spent in the entire calendar year on all of these benefits, including doctor visits, including blood work, including imaging, including chiro, including prescription drugs. Once all of that in total equals $8,750, then I pay nothing for the rest of the calendar year for all covered services, and Blue Shield pays 100%. So in that scenario, when I have that $100,000 hospital bill, I'm only going to pay up to $8,750, and then they pay 100%. Now, as we remember from our example, before my hospital stay, I already paid $900 for my MRI. So really, my hospital stay would cost me $7,850. That's $8,750 minus $900. So that's how these benefits work. And you'll notice how now that we've gone through that, you can see how this deductible of $1,500 is better than $2,300 and $500 is better than both of them. And the out-of-pocket maximums, your worst case scenario gets lower with these plans. Copays are lower. There's no brand name drug deductible in this gold plan here. You'll notice that surgery copays are much lower. Now, instead of 50% in the emergency room, I'm paying $300 after I've met my deductible. So that will really reduce your costs. So that's your silver and gold HMO plans. With those Trio HMO plans, you have access to the Trio Concierge program. This is a great place to start when you need help finding a doctor or specialist, when you need to find a level A pharmacy, when you need help understanding your plan, when you have claims issues, okay? All of these things are really, really helpful through the concierge team. You can see the phone number here at the bottom, 855-829-3566. This is a great, great option for anybody enrolling in the Trio HMO plan. It is only available for the Trio HMO plan. It's not available for the full Access Plus HMO or PPO plans. Here's a little look at the most popular networks, medical groups and hospitals in the Trio network here in San Diego. This is not all of the medical groups that you have access to, but it is the most popular ones and probably the ones most of you guys are actually accessing currently. Here's a look at our Platinum Trio HMO plan versus our Platinum Access Plus HMO plan. Okay, Platinum plans, the biggest difference you're going to see is in this maximum out of pocket. Remember, with our silver and gold plans, these maximum out of pockets are very high, but check out how low they get with our Platinum level plans. This means that in the worst case scenario, if I'm on this Platinum Trio HMO plan, the most I would ever spend in a calendar year for myself is $2,350. All right, that is fantastic. Copays for doctor visits much lower, prescription drug copays much lower. And then you see with these plans, now we have a per day cost in the hospital. So if I have that $100,000 hospital stay, and that means I'm there 7 days, I'll pay $250 a day for day 1, 2, and 3. So that's $750. And then after that's over, after those 3 days are over and I'm still in the same hospital stay, I don't pay any more for the rest of the stay, okay? Remember we talked about level A versus level B pharmacies. Level A pharmacies are CVS Pharmacy, the ones in Target stores as well, Costco, Safeway, Save-On, Bonds, all right? So this is who you want to go see. If you don't remember anything else about this presentation, remember CVS, Costco, Save-On, Safeway, Bonds, okay? That's who you want to go to. How you find a preferred pharmacy. This is how you would do it right here, blueshieldca.com/pharmacy. All right. So here's our PPO plans. Again, you'll see silver, gold, platinum. You'll see high deductible, low deductible, zero deductible, higher out-of-pocket maximums, lower out-of-pocket maximums. The co-pays are a little better. So again, PPO plans are really great for those of you that want a lot of freedom of movement, that do not want to be stuck within one medical group for all your care. This is the best thing for you. Here's a little plug for the Blue Shield smartphone app. This is a great place. If you can do one thing to improve your benefits experience, it's downloading this app. You can find doctors right there. You can message your provider. You can find nearby pharmacies. You can look up claims. You have the access to the nearest urgent care facility rather than being stuck going to the nearest emergency room. Saves you lots and lots of money, 24/7 access. You never lose your ID card. All kinds of stuff here. Please, please, please do this. Another little benefit here, mental health and licensed doctors over the phone. This is a really nice program called Teledoc. The phone number is down here in the red box, 1-800-273-TALK. Really good place to start your journey if you're looking for some help with things that are going on in your life, depression, addiction, grief, anxiety. That's a good place there. Also, this is not just about mental health. It's about cold and flu symptoms, allergies, sinus problems, basic care. So really great place to start for those minor medical issues or to start your mental health journey. So let's talk about dental. Nothing changing here. We got our bronze, silver, gold HMO, low, medium, high level plans. All of these plans have access to the same dentists. HMO dental plans are going to be much smaller in network of who you can see. You will always have to start by going to the same dental primary care provider to do anything. So there's some limitations on who you can see here, but it costs you a lot less out of your pocket when you use the plan, and it costs you a lot less out of your paycheck. So great option on the Delta Dental HMO plans. Our PPO dental plans, again, good, better, best. That Platinum Premier Network plan has the highest maximum benefit and the largest network providers. Now, one thing to note with PPO dental plans is calendar year maximum. This is the exact opposite of what we talked about with medical. With medical, we said once you hit the maximum, then the insurance company pays 100% and you pay 0. With dental PPO, it's the exact opposite. With dental PPO, once you get to the calendar year maximum, then they pay nothing else and you pay everything else. All right. So that's why these plans having these maximums at 1,000 is not as good as 1,500, is not as good as 2,000. So very important note about how they cover that calendar year max there. Let's talk about our vision plans, same as last year. We have the gold, we have the platinum. Both of these plans have the exact same providers you can see. Both of these plans give you the $10 copay for an eye exam every 12 months. Both of these plans give you the exact same $25 copay for new lenses every 12 months. The difference between the gold and the platinum is the $180 allowance that you get on the gold plan is once every 2 years, whereas the platinum plan, that $180 allowance is once every 1 year, once every 12 months versus 24 months. This platinum plan costs less than $24 more per year. And for $23 and some change per year as an individual, you get $180 of additional benefits. So really a great option is the platinum plan. Nothing wrong with the gold plan, just the platinum provides a little better value, and I recommend that plan. So logging in and making your elections, it's at performancetitanium.ease.com. The login looks just like this. Once you get this email here, which you should shortly, it's probably why you're watching this video, you'll log in here. You will see this landing page here. You'll enter your username and password. If you haven't done that before, you can add your password, accept the terms and conditions, all that kind of stuff. Then once you get in there, you're going to hit this start enrollment button at the top right. It'll take you to the page where you hit the start button, gives you an idea how long this should take. For those of you that have already been through this system, it's not going to take you anywhere near 15 to 25 minutes. It's going to be a very quick run through because your plans that you're already on will be pre-selected. You'll enter your personal information. If you're already in here, you'll notice it's already there. You might want to review it, make sure there's been any change. You can update that. You'll select your medical plan. Again, hitting the check mark will turn it green. X will turn it red. You must do this in order to see these benefits and these rates down here. So here they are. You'll select it. You'll see lots of different links here at the bottom for you to click. One thing I want to notate about your benefit plan, your employer is increasing their contribution by $25 extra this year. So as the rates are going up, your employer is paying their portion more. So you guys are basically splitting the increase from last year in most cases. So your employer is being generous and is taking part in these increases and adding to the contribution level. So now they pay the first $525. Once you go through this process, you'll go through the review your plan choices through the benefit summary. You can print it here. Once it's all good, you'll hit continue. You'll see this box to sign forms. You'll click that box. It turns into DocuSign. You'll type your signature. You use your mouse or your finger on your mobile device to write it. Hit next. Then it'll take you to this page. You hit this little finish button in the top right. You'll get this email saying, thank you, it's been submitted, and you're all done. So what's the next step? You're looking for that email we talked about. We want you to log in as soon as possible. Make your elections. The deadline is Wednesday, October 25th. If you have any questions, if you need any answers, we are here for you. Thank you very much for your time. It's an honor to be your broker, and I look forward to hearing from you soon. Thank you.